The rural healthcare crisis in Alabama isn't going away. It started more than a year ago when Monroe County ended its labor and delivery services.
In the last 6 months, Grove Hill Memorial Hospital was forced to end labor and delivery services. Thomasville Hospital has since shut down entirely. So
what's being done to address this growing rural healthcare crisis? Shelby Myers is getting some answers.
Since I first investigated a maternal health care desert in rural Alabama 6 months ago, things have seemed quiet when it comes to addressing the problems. But as I'm finding out, some of Alabama elected officials have been working behind the scenes to try and save rural health care.
I don't think that mothers and families are even their priority. We're not making in the money.
When I first found out, I was like, what we gonna do next?
People in these rural areas, we've been overlooked and forgotten for so long. I believe we've become desensitized to it.
In August, I spoke with multiple mothers asking them what they were going to do when Grove Hill Memorial shuttered its 75-year-old labor and delivery services to save the hospital. It was one of the last remaining birthing units in South Alabama. They felt scared, frustrated, and forgotten. Monroe County Hospital had already ended labor and delivery services, citing a lack of insurance and a doctor shortage. Thomasville Regional Medical Center had to close its entire hospital in September, less than 5 years after opening, because of what the mayor says was financial difficulties and staffing shortages. According to a report from the Center for Healthcare Quality and Payment Reform, more than half of Alabama's rural hospitals are currently at risk of closing. The rural healthcare crisis is not only plaguing Alabama, but the entire country, too. So what's being done to support rural healthcare? At the federal level, Alabama Senator Katie Britt, along with a bipartisan group of senators in other states, is reintroducing the Rural Obstetrics Readiness Act.
In Alabama, we have about 30% of women who are more than 30 minutes away from a labor and delivery site here.
It would help rural hospitals and doctors prepare to handle the obstetric emergencies by creating training programs to help non-specialists respond to emergencies like labor and delivery. It would provide federal grants for rural facilities to buy better equipment, and it would develop a pilot program for teleconsultation services, so a doctor at a rural facility helping an expecting or postpartum mother facing an emergency can quickly consult with maternal health care experts.
When you look at the fact that we have, out of our 67 counties, over a third of our state is actually a maternal care desert, this is clearly something that we have to hit head on.
At the state level, 2 Alabama representatives have sponsored health care focused bills. Representative Terry Collins, a Republican out of Decatur, is sponsoring HB 86. It would provide tax credits to donors who want to support rural hospitals. Individual and business donors would receive a 100% income tax credit, which would be pulled from both the general budget and education fund. Representative Ed Oliver, a Republican from Dadeville, is sponsoring HB 46. It would change the language of the current laws in place that doctors have to live and work in a community with a hospital to qualify for a tax credit. It also raises the tax credit for rural physicians from $5,000 to $10,000. Shelby Myers, Fox 10 News.